Dr. Marzena Krawiec is here talking, she's a pediatric pulmonologist, also a Denver Bronco fan. I was letting her know Connor Barth is from here. Your kicker. So now you have a reason to pull for the local guy.
That's right. Go Broncos.
There
Love Peyton Manning.
I saw him play against the Panthers. But we're not going to talk football. We can do this in the commercial break. We'll talk about the asthma, what we want to talk about today. School starting up with children, a lot of the activities in the summer. How prevalent is this in kids? And when do we start kind of seeing this in children where it starts to develop?
Well, asthma is a leading cause of chronic disease in pediatrics. It is in 1 out of every 11 children have asthma. Asthma can be diagnosed very early on based on recurrent episodes of wheezing in the first several years of life. And it is very much a chronic disease, but unfortunately we treat it more sporadically.
And I was going to say, from what I've learned of this, reading on it a little bit last night and into this morning, it's something that it's incurable, correct?
It is not a preventable disease. You can manage it with daily controller therapy, which is very critical and often misunderstood that that's critical.
I would think that springtime with pollen and things like that is when you see a rise in this. But again, with school starting up, is it something that you see in schools, that once schools get going and these kids go back, that maybe there's a spike in it as well?
Absolutely. There's a tremendous spike going into September, October with kids returning back to school. And the reason for that is because a lot of kids take vacation holidays off of their medications. And then they come into the schools have been closed down, there's increased allergen exposures, plus the viral illnesses, and they haven't been on their medications, so they're unprepared. So there is a tremendous spike going back into the school year.
What are some of the things that parents who they know their children already have it, and then parents like myself, my kids as far as I know don't have asthma. What are some of the signs we want to look for that we start to realize there's a problem?
Children that are getting breathless with exercise, children that are starting to have coughing, especially at night. It's a critical feature, especially in young children, if they are coming and coughing at night. Children that during the day seem out of sorts with cough and wheeze. A lot of times we think, oh, I didn't see any wheezing. Well, cough is very prevalent too. A lot of nasal congestion, things like that, leads to the lungs tightening up and the airways becoming narrowed.
When we mention how this is not something that we can cure, but we can manage, walk me through the steps of that. I mean, you see the ads on TV where there's inhalers and things like that, but for kids that are small, how do you manage that?
For kids that are small, you do prevention measures are most important. Smoking exposure is one of the most common causes of airway constriction, airways getting narrowed and having difficulty. You try to limit allergen exposure, however, that's difficult. But the key to managing asthma, the #1 controller, is the use of inhaled corticosteroids and using medications daily, and not just sporadically using things like albuterol, bronchodilator medications.
And I always kind of end these segments by saying, if you have questions about like this or anything else, you don't want to ask me, because I went to school for 4 years. She went a lot longer than I did, and she gets the white coat. Yeah,
too long. Yeah, I do get to wear the coat. I have my Coastal Children's emblem, and please come and see us.
And I'm guessing a Broncos jersey somewhere.
Bronco jerseys every Friday to clinic. Every Friday. We're fist pumping that.
And we're back after this.